So Dr. Yamini SAHU is with us, and she's going to talk about culture-proven fungal endoph following phakic ICL implantation.
Doctor?
Yamini SAHU. I think she's the fourth one.
नहीं.
The first three speakers are not there.
No, I think इसके हिसाब से बुलाना है वो कुछ गलत है. यामिनी साहू, fourth one.
So good morning, everyone. I'll be presenting a case of culture-proven fungal endophthalmitis following phakic ICL implantation. So a 32-years-old male presented to us with history of diminution of vision in the right eye for past 1 month. He had a history of undergoing ICL implantation around 1.5 months back elsewhere. Post-ICL implantation, 15 days later, he had developed blurred vision in his right eye, and the operating surgeon suspected a post-operative fungal endophthalmitis, and he explanted the ICL and injected intracameral voriconazole. However, clinical worsening was noted, and the patient was referred to us for further management. So this is the first day when the patient presented to us. He had a best-corrected visual acuity of 618 N6. As you can see in the slit lamp image, there was a very mild streak hypopyon. The vitreous cavity was essentially clear, and the retina was on. We performed an aqueous aspirate, which was negative for KOH and gram stain. The culture was also negative. However, the PCR was positive for U bacterial genome and negative for fungus. We started the patient on steroid eye drops and antibiotics. This is the second day picture. As you can see here in the slit lamp image, the AC exudation had increased and the hypopyon also increased. The vitreous cavity was still clear. So we injected an intracameral antibiotic because the U bacterial genome was positive. We also performed an AIOS2025 where no infective granuloma was seen. Third day, exudates had increased again, so we performed an AC wash. The second aqueous aspirate, however, showed septate fungal filaments in the KOH stain. The culture was still negative. So we diagnosed the case as a case of post-ICL fungal endophthalmitis and started on topical and oral antifungals. He received 2 doses of intracameral voriconazole, but on the 8th day, the clinical worsening was again noted, and AC exudates had increased. There was no view of the fundus, and now the patient had a vision of hand movements. So we took the patient for lensectomy, vitrectomy, along with intravitreal voriconazole injection. The PCR was positive for fungal DNA to the vitreous aspirate. As you can see here in the KOH stain, fungal filaments, septate fungal filaments were seen, and SDA showed fungal colonies, which was Aspergillus flavus. So post the surgery, patient received approximately 9 doses of intravitreal voriconazole every 48 to 72 hours. We started the patient on oral and topical antifungals. At 1 month of follow-up, his best corrected visual acuity was 624 N24. Anterior chamber, as you can see here in the slit lamp image, was essentially clear. The fundus vitreous cavity was clear, retina was attached. So post-ICL endophthalmitis, although is rare, is a vision-threatening complication, the rate approximately being 1 in 6,000. There is lack of literature on the incidence, outcomes, and the preferred practice patterns. This is the first culture-proven case of post-ICL fungal endophthalmitis in India and second reported case in Asia. There are no separate guidelines for fungal post-ICL endophthalmitis, so we generally follow the recommendations for post-cataract endophthalmitis. Conservative management is preferred in mild cases with or without ICL explantation. However, past vena vitrectomy and ICL explantation are required if the condition deteriorates. So the take-home message from my case is persistence of infection post-ICL explantation. Like in our case, ICL was explanted, but still there was persistence of infection. So it highlights the fact that only ICL explantation may not be sufficient in controlling infection in some patients. Vigilant follow-up is required because, as in our case, the patient exacerbated approximately 1.5 months post-surgery. So vigilant follow-up is required with prompt surgical intervention and multiple antifungal injections. Our patient received approximately 10 antifungal injections, intravitreal injections. So this is also very necessary to help achieve better outcomes in such cases. Thank you, sir.
Thank you, Dr. Yamini. 2 things. Why was lensectomy done?
Sir, actually, anterior in the AC the fibrous strands and all was also very much stuck to the lens capsule. Initially, when we performed the AC wash, we thought that post the AC wash, there will be no lens adherent capsular fragments. But while operating in the initial plan was plus minus lensectomy, but he underwent lensectomy because we thought that even the lens, this thing was attached.
Second thing, you said voriconazole was given 48 to 72 hourly.
So every depending.
But the half-life of voriconazole, ideally, if you go by the books, it should be given every day.
Yes, sir. But we did it 48 hours because depending post the surgical intervention, depending on if we see that the vitreous cavity, how is is the haze increasing or there's some exacerbation depending on that, sir. But we didn't get it done every this thing.
So ideally, the dosing of voriconazole, if you go by the half-life, should be every day.
Yes.
We don't end up because it can be retinotoxic, but 72 hours is a big no.
Yes.
So this thing is either you take every day, see the patient, take a call, and then give.
Yeah.
Thank you.
So you gave 9 injections of voriconazole. Did you?
Post surgery, yes.
That's okay. So at any point of time, did you think of switching the antifungal? Like maybe it's not working. You gave 9 injections. Maybe you should have started amphotericin B or something.
Yeah. So, but actually, this thing was aspergillus, and it was responding. Only thing was just the clinical judgment that okay, the haze was decreasing, so we continued with the same.
If it is responding, generally, at least in my clinical
Yes,
experience, I've never come across a patient in which I have to give 9 injections and it is responding. If I have to give so many
Either
injections.
it starts responding after 1 or 2, or you change the.
But like post the 1 month, this thing, everything was settled and.
That's okay.
Yes,
So maybe a switch could have
Yeah.
been considered.
Yes. Yes.
Okay. Sure.
Thank you, sir.
Thank you.